It's the down. Hit the down.
Okay, these are some of the topics I would like to cover with you, if time permitting.
I'll give you 5 minutes.
Oh, all right, thank you. I invite you to set your preconceived ideas that you have aside for a few minutes and just listen to the presentation with an open mind, and then you can make some different decisions. Colon hydrotherapy has been around a very long time. It's the 17th century. Most early systems required the use of an assistant to perform the procedure, and the doctors that thought it was beneath their dignity, so they turned it over to the barbers and the assistants. And this is a picture to give you some idea why it was turned over to the to the apprentices. You see, there's not much dignity in that. The history goes way back. Louis XI credited the enema with relieving attacks of seizure. Louis XIII received over 200 colonics in 1 year. And this is King Louis XIV. You can see he is having his colonic, and he had court functions and visitors during his procedure. How would you like to have a colonic with a room full of people? I wish the previous speaker would have set up one of those deals in here, but they gave us all a lot of energy, wouldn't it? Here in England, we took time to go down to the Westminster Abbey to look up a few things, scientists and poets. And this one is was Thomas Parr. He was a farmer. He didn't live in London, but King Charles had heard of him, and so he sent for Thomas Parr to come to visit. Well, he was such a great entertainer that the king invited him to move into the castle with him because he told some wonderful stories. Well, shortly after he had moved into the castle, Farmer Parr, he sold his farm. He quit eating his normal foods and moved into the castle where he had all these rich, wonderful foods. And back in those days, they had lots of smog because everything was heated here with coal. And he'd been there for just a few days when he died. So the king had his physician, William Harvey, do an autopsy on Thomas Parr to see what killed him. And after the autopsy, it's still preserved at the over at Westminster Abbey, and it's in Latin. But they found that he died from the overindulgence of rich foods and the smog that was in the area. I invite you all to go to Westminster Abbey if you haven't been there. It's quite an interesting trip. And back in some more history, back in the early 1900s, Dr. Kellogg was a medical doctor, and in the early 1900s, he had a hospital in Battle Creek, Michigan. But in the early 1900s, they sold opates through the mail. And so I'm sure you're all familiar with it, but when you take opates for a period of time, it shuts down this end and this end. So he'd treated over 40,000 people using colon hydrotherapy, and he only had to do surgery in 20 cases out of 40,000. Colon hydrotherapy is been around for thousands of years. First, we know there's some value in cleansing the colon. Second, it's never received the attention it justly deserves. There's just not been enough studies done on it. And I'm sure somebody here in England will take this up and do a study. Colon hydrotherapy is an extended and a more complete form of an enema. It hydrates the colon. It gets rid of the waste. It cleans beyond the rectal sigmoid area. And we're using safe, modern equipment today. Your privacy is maintained and your dignity is also maintained. I had a picture on here to show you some of it, but I thought it was too commercial, so we took the picture out. We didn't want to do any commercials while we're here. We will be displaying out in the lobby. The laxatives and enemas versus colon hydrotherapy. As you can see there, if this is a laxative, it will clean the rectum area out. This one here is the effect of an enema. It will clean all the way up to the sigmoid and a little bit up the ascending colon. But colon hydrotherapy will clean all the way over to the cecum area. Diseases and functional disturbance of the digestive system is the most complained about problem in the United States. I don't know about here in England. You doctors are the ones that are here. But it's the most complained about problem that we have. Laxatives, it's a chemical, whether it's chemical or herbal, it's a laxative, and that is an irritant to the body. And what does the body do with an irritant? It will pull water and cell salts out of the tissue to try to flush that through. Generally, it just goes around the blockage, so you end up with constant diarrhea and constipation. Diarrhea and constipation because the body's trying to get rid of what's bothering it. Indications. These are personal observations. It's good for detoxification. It's good for constipation, indigestion, functional bowel problems. And when it's indicated, colon hydrotherapy is beneficial to improve the elimination of the digestion system and support the rest of the body functions, thus avoiding the toxic symptoms that causes disease. There's contraindications for colon hydrotherapy, and this lists just a few of them here. And fissures and fistulas. No, it doesn't work. These are probably caused by the constipation because of stretching and the tearing as the hard bolus goes through the bottom of the anus. These are some more of the contraindications. Renal inefficiency. I personally know that when I have someone going over to get dialysis done, I have them come in for about an hour before they go to get the dialysis done. And this cleans out the feeder, and it makes them feel so much better than just going to have dialysis and having the blood cleaned, because if you can take care of the feeder, you're going to also help the blood. One of the other ones that is pregnancy. They say the first and last trimester you shouldn't do colon hydrotherapy. Well, that's generally because our country is just lawsuit happy. If you have a miscarriage in the first trimester, well, they'll say, well, blame it on the colon therapy. If you have a premature birth, well, in the last trimester, well, blame it on the colon therapy. We'll sue the bastards. That's the way they are in America. But I have a gastroenterologist in Las Vegas. He has 8 colon therapy units, and he uses his colon therapy on all his patients. He feels that colon hydrotherapy, the hydration and the cleaning out is much better than trying to use the chemicals for the mother and for the baby. So a lot of the contraindications are because of lawsuits. Some of the benefits: it rehydrates the bowel, toning of the bowel. Any of you ever done an exercise program? You know how you start. The more you do, the stronger you get. Well, that's what happens with colon hydrotherapy. You can literally retrain the bowel to start working again. I've had patients come in that have been on laxatives for a long time, and the bowel just quits working. But we do reestablish where they start having at least one bowel movement a day after they've did a series of colon hydrotherapy. It's effective in the preparation for bowel and diagnostic studies, which I'm going to show you some of those. It also improves the immune system. I have another doctor that, lupus is supposed to be an immune disorder attacking the body. He sends his patients in for colon hydrotherapy, and he's reporting that he is having great success with it. But we don't have a study about it, so we can't give you any guarantees. This is a study that was done in Singapore, and the objective was to evaluate the effectiveness of colon hydrotherapy to see how well it does for colonoscopies. Well, the results was 98% positive. The colon hydrotherapy is an effective means of cleansing the large bowel in cases undergoing colonoscopies. It's more effective than the use of either oral mannitol or magnesium sulfate as a means of cleansing the large intestine prior to a colonoscopy. This is a study that was done in the northeast United States, and it's a 80-year-old male, diabetic, hypersensitive. He hadn't had a bowel movement in 7 days, so they put him in the hospital. And the first thing they did was to give him magnesium sulfate and 2 Dulcolax suppositories. Then they put him on the toilet. Didn't have any success. This is a picture of him. See how distended his abdomen is? Well, the management of it, first thing to do was ensure that he was clinically stable, and then they help the patient evacuate the bowel. They give him the first colon therapy session. They stopped all solid foods and put him on a liquid diet.